Hello everyone, my name is Dr. Josephine Grace Chua Rojo. I'm usually known as the Diet Doctora because I focus mostly on nutrition, specifically low-carb nutrition and fasting. But my specialty as a doctor is really ENT, ears, nose, and throat. And I became an ENT surgeon, ENT and head and neck surgeon because there is no direct way into becoming a facial plastic surgeon but through becoming an ENT first. So as I finished my studies and my training in ENT, I now subspecialize in facial plastic surgery. So with facial plastic surgery, we usually focus our experiences and procedures in improving the facial profile of a person, mainly for aesthetics. There are also aesthetics and plastic surgery mostly for pathologic cases to improve the pathologic cases, say for example burns or congenital anomalies, but mostly it is for the purpose of improving with or without functional improvement. So it's mainly because of aesthetics. And I am doing this vlog to record my own personal journey. As a plastic surgeon, I will also undergo plastic surgery myself. It's not about just improving or self-esteem or whatever, but as a person, I consider myself as an artist. I've always been thrilled with aesthetics, with beauty. I do makeup with other people. I also do a lot of arts and crafts. I paint, I draw a lot, and I'm just into art. But the most important kind of art, the most favorite art for me is when it is done in the human face. So among many things that my hands can do, that my hands can touch, it is with the human face and the human body that I am really feeling a lot satisfied, I feel a lot fulfilled, and I feel a lot of happiness, especially when my patients are also very happy with the results of the procedure that we made. And ever since young, I always knew what to do with my face. That's why I use makeup, because I know how to tone down the parts which are not so desirable and to emphasize the stuff that is also desirable. So even if others will say that I look okay, yet I know that there can still be some room for improvement, a lot of room for improvements actually. So if I will analyze myself, so my nose has a bridge, so it has a little bridge here, but it can actually benefit from little augmentation. So maybe we can augment using Gore-Tex artificial graft, or we can also do like cartilage graft or the ones from the rib, or we can also do some osteotomy to pinch this one and make it higher. But most likely my surgeon, which is also my mentor and also one of the most important people why I've decided to go in this journey because of my trust in him, will usually mostly do just Gore-Tex, maybe just 3 mm, maximum of 5 mm, I think, because too high would also be not good. When you think of the aesthetic nose, it's not just about the nose, but you also have to consider the forehead. So with the forehead, there is a good angle supposedly that will increase the nose, and also you have considered the lips and also the chin. So those are the factors. So the augmentation will be needed. We will get harvest from the cartilage in the ear so that it will be added as a tip. So my tip is somewhat bulbous, it's more circular, so it's not very pointy. So we need to increase that one, like this one, this effect. And also my ala is actually quite big, although it's just match my big face, but it can also use some trimming. So my ala would also be trimmed a little. It's called alarplasty. Plus there is an overhang. So an overhang is when your columnella, this one, is actually just on the level of your ala, or if the ala is even lower than columnella. It's not very obvious with me because whenever I smile, it raises, so it's not obvious. But when I don't smile, like that one, you can see that there's overhang. So it's like the bat is downwards, so wing of a bat, and it's downward here. So what we need to improve on is to make this a little higher and make this smaller. Can you see the difference now? And also this one, the tip should be improved like that one. So those are the plans. And also I think my mentor, my surgeon, will also do some blepharoplasty, because if you can see my eyes this wide, this is actually a lot of effort for me to widen it. Because if I don't actually exert any effort to widen my eyes, it's just really, really small. And without the eyeliner, my eyeliner is very, very thick already. So without eyeliner, without effort on my part, my eyes would just be like a little slit here. So those are the things that needs to be done in my face to improve this one when it comes to aesthetic sense. So when it comes to aesthetic calculations, when it comes to my nose and also to my eyes, so it's going to be a different look. And with this new transformation, others will feel that maybe I will already look different from my family, but actually no. If I will do this procedure, this surgery, I will now look more like my sister, look more like my mom, look more like my aunts, because I'm actually the only girl in the family who have this quite a bulbous tip. So nose is very important in improving the overall reflection of a person because it is quite in the center, and although it is not very dramatically bad or dramatically ugly, but improvement on the nose, which is in the mid-face, can also improve a lot. So I am doing this not for anyone, but just for myself. It is just a bonus that my loved ones, my colleagues, my mentors, my family are all very supportive with this one. I'm very happy that they are very supportive of me. But regardless, with or without support, I have decided to proceed with this procedure. I will see you in our next video, in our next vlog. And this one is just a recording for you to see how I look. This is my before face, and we will see how will I look after. Expected that the first week it's going to be a lot of swelling. It cannot be appreciated yet because there will be a cast in here and a lot of bruising in my eyes. On the second and third week, it will subside a little, but still there's still expected swelling, and it's going until 10 to third month that the full healing will eventually be seen. So that's it. I hope to see you, and I hope you get to learn more about what you really want in life and what you are going to do about it, and just do whatever it is that you feel like it's really good for you. So taking care, not just about our health, not just about our nutrition, not just our spirituality, not just about our mind and mental wellness, but overall, and physical aspect is also part of that. And that is a part of my self-healing, self-improvement, and my journey into leveling up and improving into the best way possible that I can be in this life. So thank you so much for all your support. I'll see you in our next video. Bye!